Hi, in this presentation, we will discuss about pharmacology of antiasthmatic drugs. Asthma, which is inflammatory condition with underlying hyperactivity and hyperresponsiveness of tracheobronchial smooth muscles to various stimuli, which results in narrowing of airways, that is reversible airway obstruction, with increased mucus secretion, mucosal edema, and mucus plugging. Symptoms of asthma: dyspnea, that is difficulty in breathing, wheezing, cough, and limitation of activities because of asthma. Triggering factors for asthma: allergy, irritants, infection, pollution, exercise, and exposure to cold air, etc. Airway remodeling like fibrosis and progressive worsening of asthma may happen in long term if remain untreated. Antiasthmatic drugs, bronchodilators, which include sympathomimetics, which are basically adrenergic beta 2 agonists, which include salbutamol, terbutaline, and bombuterol, which are short acting beta agonists, and sarmotrol and formoterol, which are long acting beta agonists. Second category in bronchodilators are methylxanthines, which have direct bronchodilator action. This includes theophylline, aminophylline, hydroxytheophylline, and doxophylline. Third category of bronchodilators include anticholinergics, which are muscarinic M3 antagonists, and these includes ipratropium bromide and tiotropium bromide. Next category of antiasthmatic drugs is leukotriene antagonists, which antagonize the action of leukotriene, which is inflammatory mediator. And drugs includes montelukast and jafelokast. Third category of anti-asthma drug is mast cell stabilizers, which stabilizes the mast cell and inhibit the release of histamine and other mediators of inflammation. And drugs include sodium chromoglycate or cromolyn sodium and ketotifen. Next category of anti-asthmatic drug is corticosteroids, which are basically anti-inflammatory. And two categories: systemic corticosteroids like hydrocortisone given intravenously, prednisolone given orally, and inhalational corticosteroids, which includes beclomethasone, dipropionate, budesonide, fluticasone propionate, flunisonide, cyclesonide, and mometasone. Next category is anti-IgE antibody. As example include omalizumab. Now coming to sympathomimetics, which are basically beta 2 receptor agonists. So they stimulate beta 2 receptors, thereby increase cyclic AMP in bronchial smooth muscle and produces bronchodilation. They decrease the inflammatory mediator release also. Examples are ephedrine, which is non-specific adrenergic agonist, which acts on alpha, beta 1, beta 2 all receptors. Because of non-specificity, it is having more side effects. It's not used commonly nowadays, but is available in some combinations. It has with its slow acting, having 3 to 5 hours of duration of action. Next category is short acting beta agonists, and these include salbutamol, which is given orally as well as inhalation, and terbutaline, also given orally and by inhalation, bambuterol, which is That when the Bambital, which is given orally, and this is terbutaline prodrug. The next category is long-acting beta agonists, and these include salmeterol and formoterol. Salmeterol is having slow onset of action given by inhalation, and formoterol also given by inhalation, and is having fast onset of action as compared to salmeterol. Next category of antiasthmatic drugs is methylxanthines. Methylxanthines, they relax bronchial smooth muscles, increase mucociliary clearance, stimulate respiration, decrease histamine and other mediators release. They are also mild, also having mild diuretic action. They also increase metabolism, stimulate heart rate and force of contraction. Because of these action, they may have side effects when used during asthma. Mechanism of action involves increase of calcium release in cardiac and smooth muscles, inhibition of phosphodiesterase, which increase cyclic AMP and produces bronchodilation. Next mechanism is blocking of adenosine receptors, thereby prevent action of adenosine. Adenosine is a bronchoconstrictor. So, by blocking action of adenosine, it reduces the bronchoconstriction produced by adenosine. Examples of drugs: theophylline given both orally and rectally, aminophylline given orally, doxophylline given orally, and doxophylline is long acting and it also does not interfere with the sleep. Next category is anticholinergics. These are basically muscarinic M3 receptor antagonists, and they prevent action of acetylcholine, which is a bronchoconstrictor on bronchial smooth muscles. Examples include pratropium bromide, which is short acting with 4 to 6 hours duration of action, and tiotropium bromide, which is long acting, having 24 hours of duration of action. Next category is leukotriene antagonists. Leukotriene 1 receptor antagonists are available. Examples include montelukast and jafelukast. Leukotriene produces bronchoconstriction, and leukotriene 1 receptor antagonists, they prevent action of leukotriene, thereby prevent bronchoconstriction. They produce bronchodilation, decrease sputum eosinophil count, decrease bronchial inflammation, decrease mucus, and decrease hyperactivity. Example, I already told you, montelukast given orally, jafelukast given orally. And there is another drug called diluton, which basically blocks leukotriene synthesis. So they, by decreasing leukotriene synthesis, reduces the bronchial constriction. Next category of anti-asthma drug is mast cell stabilizers. They decrease degranulation of mast cells and other inflammatory cells. They decrease release of histamine, leukotrienes, platelet activating factor, and interleukins release. Examples: cromolyn sodium given by inhalation, and ketotifen. Next category of anti-asthma drug is anti-IgE antibody. So, example is omalizumab. It is a monoclonal antibody which is given subcutaneously. It neutralizes free IgE, and it is effective only in IgE positive patients, which are mainly allergic asthmatic patients. It is very expensive. Next category of anti-asthma drugs is corticosteroids. They decrease bronchial hyperactivity and mucosal edema, decrease antigen antibody interaction inflammatory response. They decrease reaction to other stimuli also. They produce anti-inflammatory action, improve airflow, decrease exacerbation of asthma, may influence airway remodeling also, like decreases fibrosis and decrease the progression of asthma. They also increase beta 2 agonist responsiveness. Example of corticosteroids, hydrocortisone, which is given intravenously, prednisolone given orally, and there are many drugs, many corticosteroids given by inhalation. Examples include beclomethasone, budesonide, fluticasone, which is 2 times as potent as beclomethasone, cyclesonide, which is a prodrug, and mometasone. That's all in this presentation. Thank you very much.